So for some folks, getting a haircut is like a chore. It's like, oh, it's just something I have to do. It's on my schedule today. But for others, it gives you a sense of normalcy.
So we're checking back in with Dina, who is live at UC Davis Medical Center, where some long-term patients are getting pampered this morning.
Yes, good morning to you. You know, it's something that many of us might take for granted, but getting your hair cut, feeling like yourself when you look in the mirror, getting a little pampered, and just having that small moment where you have that normalcy can be so important. Imagine being a patient in the hospital for weeks or even months on end. And so that's why we're here this morning, featuring the CAREcuts program here at UC Davis Medical Center. John is patient number one for us today. This is John, and his stylist is Crystal from Cuvée Salon, or Salon Cuvée, and they are working together to give John a nice fade. John, you have been in the hospital, you said, for a couple of weeks now, and remind the folks at home who didn't see our last segment why you're here.
I'm here because I got cancer, lymphoma, and leukemia.
And you've been here for about 2 weeks?
Yeah.
Okay. How often would you say you get your hair cut?
About every 2 weeks.
Okay,
Yeah.
so were you pretty due for one?
Oh, yeah. Yeah.
What's the experience like coming into the hospital setting and just having this moment for you?
Well, it's kind of scary.
Yeah?
It's scary. This is the best part.
Yes, the haircut.
Yeah,
Yes, yes, absolutely,
The whole cancer
absolutely.
thing's scary.
Yes,
Yeah.
of course it is, and we're so sorry to hear that you're going through that, and I hope that this gives you a sense of at least a break from the monotony of the day, right? The day can probably feel so long when you're in
Definitely.
here.
And I'll feel better when it's cut.
Exactly.
Thank
Feel
you,
nice.
Crystal.
Thank you, Crystal. And so, perfect transition. So, Crystal, this is actually the second time you've come around to do the program now. Volunteers, there's about 20 volunteers from salons around the area who are here doing this, and it's kind of a quarterly option for folks. So, tell me what it's like for you as the stylist to be behind the scissors this morning in this setting.
So it's really nice. It's a little change of pace, and it's, something to give back. And I have been on the other end where I have been, at the hospital with family. So I know like how much this could relieve people and help them out a little bit and, get a little normalcy in their life. And it's a little way to give back where we can, So it's nice.
Oh, it is so great. Well, John, you said what was the number that you're getting cut today?
Well, number 2 is
Number 2,
yeah.
and a fade.
Yeah.
Number 2 and a fade. That's the John cut. So if you're coming to UC Davis and you know that CAREcuts is coming around, just ask for the John cut. I also have to give a quick shout out to fiance Jenny over here in the corner. This family up from Portola, California. So we wanted to highlight them and just say thank you for watching Good Day and for being such loyal viewers. You said every day.
We watch it every day. Yeah.
Well, that makes us feel good. I'm so happy to hear that. For you, John, we are wishing you well with your diagnosis.
Thank
You look great, though. I know you don't have a mirror yet, but do you feel lighter?
Yeah. It's off my ears and my neck right now. Yeah. Feels much better.
Jenny, how's he look?
He looks great.
Let me ask you here. How's he look?
He looks great.
Yeah. Oh, man. What's it like having this whole setup in the hospital room? Because this probably wasn't something you thought was going to happen.
No, this was very much a surprise. And to be on your show, of anybody's show, is really, really awesome. Thanks so much.
Well, thank you. We're so happy that your family gets a little moment of joy this morning, and we continue to think great thoughts for you, John. Crystal, thank you for what you're doing. We'll have all the information so that you can also find more about the program. It just started a little over a year ago, and again, they come around about every quarter here at UC Davis Medical Center just to help these patients who are so deserving of a sense of normalcy. All right, we'll send it back to you.
Thank you.
Thank you, Dina.